Hello, welcome to OASIS, Objective Assessment of Sickness in Neonates using Sonography. Today we'll learn how to perform ultrasound kidneys and make sure that the baby is comfortably sleeping and the proper probe you have to use. Usually we use heavy linear probe and the frequency of C8 and C5, and see there are different ways of putting the probe. You can use supine, or you can see right or left flank, or you can go to the posterior aspect parallel to the vertebra. You can do that. These are three important areas: the supine, then the lateral position or prone position. All the three ways you can check you can look at the kidney system. And when there are two ways of performing ultrasound kidneys. One is this is called as the longitudinal, where exactly you keep the probe with the facer with the marker facing up. See, this is how you have to do, and this will give you the longitudinal view. You can see the kidneys here. If you look at the kidney, this is one. I have kept two videos. One is still image, and the other one is moving image. The still image, if you look at this image, it has got two parts. It has got two parts here. What you see, the outer covering is a capsule. Next to the capsule is the cortex. And what you see in this black hypoechoic or anechoic areas, they form medulla. And this medulla has got pyramids. Pyramid has got a pointer towards the center and the broad base towards the cortex. So this is very important. In newborns, the echogenicity of the cortex is almost equated to the liver, and little bit hyperechoic because tuft of glomerulus is present in the cortex. 20% of the loops or the loop of Henle is present in the cortical area, and that will give the echogenicity of the cortex. If you look at the medulla, medulla is almost hypoechoic and anechoic. The reason is it doesn't have fat. And if you look at the ratio, the cortical to the medullary ratio, it is around 1.56 is to 1 in neonate, whereas in adults it will become 2.59 of cortex, 1 of medulla. So that means newborn has got more medullary area compared to the adult population. And of course, this is the sinuses. So this is how the kidney looks. What we'll measure here? So we measure the length of the kidney. If you look at the length of the kidney, I'll just measure from this pole until this pole. You measure. So it is around 3 centimeters. So this is how the longitudinal, the length of the kidney is measured. So are you clear? So this is on what is called as the on the 2D image of the kidney. You can see these are the pyramids. You can see, and this is the cortex, and surrounding the cortex is the capsule. Are you clear about that? And what I'll do is this is the probe here. I'll turn the probe like this. So this is called transverse view. So I'll just turn this. Then what will happen? This is the transverse view of the kidney. You can see beautifully the pelvis here open. Can you see that? And there are a lot of pulsations because a lot of vessels. I'll just put the thing. So you can see the vessels. So vessels entering into the kidney. You can see. See, this is the kidney. See how beautifully from the aorta. This is the vertebra. The aorta is entering. So how do we know which artery is that? So another important thing you must remember is when from the aorta, when it enters into the kidney, it gets divided into two parts: anterior segmental artery, posterior segmental artery. It divides, then it becomes interlobar, and then you can see that in between the cortex and medulla there is a vessel called arcuate artery. See, I'll just take this. I'll just take you there. I'll just move this. Arcuate artery is very important, which is present between the cortex and medulla. So the vessel which bifurcates the cortex and medulla is the arcuate artery. So how do we know which one is renal vein, which one is renal artery? You take the pulsar Doppler here. You see that? This is the waveform. So I'll just freeze it. So this type of wave, this is pulsatile wave. You can see the peak systolic velocity and end diastolic velocity. So this is the renal artery that is coming from the aorta into the kidney. Now there is also we have renal vein, correct? So I'll just put I'll just put one pulsate Doppler here. See, it is a continuous wave Doppler. So that means you will not find what is called pulsatility. It is a continuous. So that clearly indicates what you see here is the red one is a renal artery which is going towards the marker. The one which is coming out of the kidney is your renal vein. Are you clear about that? See how beautifully it is coming. So that's how this is very important to know that, especially when there is a renal artery stenosis or something like that, or if you want to compare the aortic flow versus the renal flow, this is very good. So that's how. So you can see the kidney and how the renal artery is entering to the kidney and renal vein coming out of that. Are you clear about that? So this is what we should know. As a neonatologist, I should know the important thing here is the length of the kidney, usually around 3 to 6 centimeters, the length of the kidney. I should know the cortex and medulla, and the vascular system is important, especially when a baby comes with shock. So we need to look at, especially perinatal asphyxia babies. So we need to look at how much flow that is entering from the aorta into the kidneys. So this is what exactly as a bedside clinician should know about the renal system. Thank you so much.